Thank you for taking the time to watch our video today. I'm Alex Morton, the Medical Director of the Denver Health Bariatric Surgery Center. We're going to be going through the program, and you'll be hearing from various members of our team to learn about the process and the surgeries themselves. Here at Denver Health, we are proud to be an MBSA QIP accredited center for both adult and adolescent bariatric surgery. This means that we have undergone rigorous evaluation through a site review to ensure that we provide top quality bariatric surgical services that are comparable in both services and outcomes to national standards. We have a multidisciplinary team that is comprised of surgeons, nurse practitioners, physician assistants, coordinators, dietitians, psychologists, and other admin support services. During your bariatric journey here at Denver Health, you'll work with and interact directly with all the members of the bariatric team. Severe obesity is a life-threatening condition and is associated with other serious medical problems like high blood pressure, diabetes, obstructive sleep apnea, and other major medical conditions. In addition, we know that severe obesity is associated with shortened life expectancy. Severe obesity is categorized as a body mass index of 40 or more, or 35 or more with an associated comorbid disease. Approximately 10% of the United States population has severe obesity. To calculate your BMI, you can go on the Denver Health Bariatric website and click the hyperlink. Using your weight and height, you can calculate your BMI and see if you qualify for bariatric surgery. While there are many non-surgical treatments that are available for weight loss, we know that studies have shown that the long-term success rates of these are poor. Thankfully, severe obesity can be treated successfully with a combination of lifestyle changes, dietary changes, and surgery. The benefits that you'll see after bariatric surgery include excellent long-term weight loss, an improvement in the associated diseases like high blood pressure and sleep apnea, and even a longer life. Studies have shown that remission or improvement in diseases associated with obesity like diabetes and blood pressure are significant and can be sustained for a long period of time. There are several ways that bariatric surgery help you to lose weight. There is a restrictive component, which means that you're unable to eat as much as you could before surgery. This helps you to eat less and take in less calories. In the gastric bypass operation, you don't absorb all of the calories that you eat as well, and this leads to increased weight loss. And finally, both surgeries have been shown to change the signals and hormones that your body creates, which helps you to feel full and have a lower appetite, which helps you to lose weight. Thank you for taking the time to learn more about the Denver Health Bariatric Surgery Program. I hope that this was an educational experience for you, and I look forward to seeing you in clinic.
Hello, my name is Dr. Pieracci. I'm the Director of Surgery and one of the bariatric surgeons. I'm going to be talking to you about eligibility for our program, payment options, and the type of surgeries that we offer. At Denver Health, we use the following guidelines to be eligible for bariatric surgery: a body mass index of 40 kilograms per meter square or greater, or a body mass index of greater than 35 with one or more medical complication related to obesity, such as diabetes and high blood pressure. In order to be eligible for surgery, you need to have no known endocrine or glandular cause of your obesity. You need to be able to understand the risks and commitment of the surgery. You need to commit to follow-up visits with our bariatric team, your primary care provider, and your registered dietitian, and you must have tried non-surgical weight loss treatments. We are currently accepting patients into our program who are between the ages of 16 and 65. If you do have a history of drug or alcohol abuse, you must be drug and alcohol free for at least 1 year before starting our program. At the Denver Health Bariatric Surgery Center, it is important to us to provide surgery to you regardless of ability to pay. We have several options for covering your bariatric surgery, ranging from commercial insurance to government insurance, as well as a self-pay option for both the gastric bypass and the sleeve. We offer 2 types of weight loss operations, the gastric bypass and the sleeve gastrectomy. Whether you have the gastric bypass or the sleeve, your surgery will be done minimally invasive with 6 small incisions and a 3D video telescope. The minimally invasive approach results in a faster recovery and fewer wound problems, as well as earlier return to work and fewer pain medications after surgery. In the gastric bypass, the stomach is divided into a small pouch and a larger remnant. The small pouch is about the size of an egg and can hold less food, which results in you not getting full as easily. The larger remnant is not removed but no longer has food in it. We then divide the small intestine into a rulum, which is about 3 feet long, and we attach that to the small pouch. The food then goes down the rulum and begins to be digested when it meets up with juices secreted by the pancreas and the liver. In the sleeve gastrectomy, we turn the stomach, which is about the size of a football, into a long, skinny garden hose. The remnant of the stomach, which is about 85% of it, is removed in the case of the sleeve gastrectomy. The sleeve is larger than the pouch that is created in the gastric bypass. The sleeve gastrectomy is not associated with any new connections like the gastric bypass is. Thank you so much for your interest in our program, and we look forward to working with you in your journey towards achieving a healthier life.
Hi, I'm Sunny Thomas. I'm a general surgeon and bariatric surgeon here at Denver Health. I'm excited for you to join us on this journey towards better health. We're going to talk about frequently asked questions. Bariatric surgery usually is not reversed. Both the sleeve and the gastric bypasses are permanent procedures. If you have a hiatal hernia, we will repair this at the same time as your bariatric surgery. If you have an abdominal wall hernia, we would prefer to repair it once you've lost weight and your weight is stable. This will be usually in around a year. You may need plastic surgery after undergoing bariatric surgery if you have loose and excessive skin. Here at Denver Health, our plastic surgeons partner with us in bariatrics after you have lost weight and your weight is stable. And if you are having problems with loose and excessive skin, we will put in a referral to our plastic surgery department. And then you can discuss with our plastic surgeons whether plastic surgery is right for you. Can I get pregnant after bariatric surgery? Yes, you can. We advise you to get pregnant after a year after undergoing bariatric surgery. Undergoing bariatric surgery actually helps you get pregnant and aid your fertility. Will I have to quit smoking and marijuana? Yes, you do. Smoking, especially the tobacco and nicotine in smoking, affects wound healing. So we ask you to quit smoking 6 weeks before your pre-op visit and then to never smoke again, because this also puts you at higher risk of developing ulcers in the connections we have made. Now, what about marijuana? We advise you to stop smoking marijuana, however, edibles are okay. Can I drink alcohol? So this is a tricky question. After undergoing bariatric surgery, the way you metabolize or break down alcohol in your system is changed. So alcohol lasts longer in your body. You have a higher alcohol level after bariatric surgery, and it also takes longer for the alcohol to come out of your system. So what does this mean for you? You will feel the effects of alcohol earlier and quicker. The effects might last for longer. And also alcohol contains a lot of sugar, so we advise you to avoid it. Who will decide whether you get a bypass or a sleeve gastrectomy? Ultimately, this will be a discussion between you and your surgeon. You will discuss both the pros and cons of each surgery. There are certain instances where the surgeon will suggest a bypass is better than a sleeve. These would be if your BMI is above 50, if you have severe acid reflux, and if you're diabetic. Ultimately, this is a discussion that we have together, and you will make the decision after having the best information provided.
I'm Annie Kulangowski, the Director of Adolescent Bariatric Surgery, and I'm going to talk to you about why adolescent bariatric surgery may be right for you. Bariatric surgery is a great option for patients between 16 and 20 years of age. Bariatric surgery is a great opportunity for teenagers and young adults struggling with obesity. Bariatric surgery has the opportunity to impact weight loss and reduce health risks for you both now and in the future. And it is also a great way for you to start your young adult life as healthy as possible.
My name is Molly. I'm a physician assistant at the Denver Health Bariatric Surgery Center, and I'm going to talk to you about our typical path to surgery. Most patients will take about 4 to 6 months of nutrition and psychology classes before they get to come see me in their official pre-op visit. In that visit, we are going to go over all of your medical history, your health history, and get you set up for surgery. Typically, patients will get their surgery date 4 to 6 weeks after they see me, and then I get the privilege of following you the entire year after your surgery as well. You're going to come see me in clinic at 1 week after surgery, 1 month, 3 months, 6 months, and 1 year. I look forward to meeting each and every one of you on this journey, and I think you're making a wonderful decision for your health.
Hi, I'm Tammy Vigil. I'm the lead dietitian in the Denver Health Bariatric Surgery Center. I'm going to talk a little bit about the nutrition portion of our program. What I think really makes our program stand out is the fact that we provide individualized one-on-one nutrition counseling in the time leading up to surgery. We help you set goals and make dietary changes that will help you be more successful after surgery. I really enjoy working in bariatrics and seeing the positive health changes in our patients as they lose weight. Your dietitian also follows you for the first year after surgery, and we have pre- and post-op online support groups that you can attend for additional support. Thank you for your time, and I look forward to working with you.
Hi, I'm Lee Reeder, the Bariatric Coordinator. Thank you for watching our informational video. Please move to the next step to fill out the contact information. This will get sent to the Bariatric Coordinator to confirm you have watched the video. Once we have your referrals, the Bariatric Nutrition Referral and the Bariatric Surgery Referral, our team will contact you to schedule the first bariatric consultation appointment. We are so excited to be working with you on this journey to a healthier life.